James, can we go to the pool today? Oh, okay. Let's go to the pool. Oh no! Oh, James up!
There are two options you can do in this scenario. Either leave the victim or perform the basic first aid action procedure known as the doctor's ABCD. The doctor's ABCD stands for danger, response, send for help, airway, breathing, compressions, and defibrillator. There are three things you need to consider when you first encounter this situation. First, danger to yourself, then danger to bystanders, and then danger to the victim. In this scenario, the danger is water.
Now we check for responses in the special response system known as CALSP.
Can you hear me? Open your eyes. What is your name? Squeeze my hand. Please let go.
Record. If there's no response, tell a bystander to send for help by dialing 000.
Hello? We've got an unconscious patient here at Carmel Morris High School. He's at the pool. Can you please bring the defibrillator? Thanks.
Next, check if there's any small objects blocking the airway in the mouth and clear them out. But when the victim is vomiting, lay him down in the recovery position, and then stick your fingers in the victim's mouth and slowly pick out the things out of the mouth that may block the airway, including tongue, food, and water.
There are three aspects you need to consider after clearing the airway to check if the patient is breathing. You have to use your senses for this one, which includes look, listen, and feel.
If there's no response, start to perform CPR. CPR stands for coronary pulmonary resuscitation, with cardio meaning anything associated with the heart, pulmonary meaning anything associated with the lungs, and resuscitation is another word for reviving. Combining all these elements, we are essentially trying to give the heart pumping blood through the body manually, keeping the person alive. To do this, we must do this legalized CPR procedure which is 30 compressions followed by 2 breaths, aiming for 100 compressions per minute. To do this effectively, use 2 hands placed on top of one another, as shown in the video, and while doing rescue breaths, pinch the nose and tilt the head back and do 2 full breaths. When it's an adult, and 2 half breaths with an infant. We're not going anywhere, so you guys can stay still and with your mouth shut. I've been waiting the whole period.
As soon as the defibrillator is available to access, use it immediately. Place the pads as shown, and then make sure nobody touches the patient. Otherwise, a shock will be delivered. We've showed you the steps.
Now can you save a life?